who will join us this live session.
Hallo, willkommen zu dieser Facebook Live-Session. Das ist natürlich Deutsch gewesen. And my name is Helmut Brandt. I'm a professor here for European Public Health, one of the few that are there around. And it's an honor to be here with our students.
Lepo pozdravljeni in dobrodošli. My name is Rok Hržič. I come from Slovenia, if you didn't recognize the language, perhaps. I am a researcher at the International Health Department. I teach in the bachelor, and I am a former master student of the Governance and Leadership in European Public Health.
Hola, bienvenidos a todos a esta reunión. My name is Sylvia, I'm from Spain, and I'm a first year student in the Bachelor of European Public Health, and I'm here today to share my experience in the program.
Okay, great. So today, this Facebook Live session is intended so our audience can ask questions, but on top of that, we will discuss questions that we get a lot during Bachelor Open Days or throughout our experience studying here at UM. I'm a third year European Public Health Bachelor student myself, and I think it would be best if we would start maybe with a question from our side. What is European Public Health and why is it important? Professor Brandt?
European Public Health is a mixture of health sciences. Health sciences deal with the question, what keeps us healthy? What are the risk factors for diseases? What can we do about it? And what kind of measures should we introduce? And the European perspective is that more and more we realize that not only one country alone can solve a problem. Just imagine you have an infectious disease that you could control by stopping air traffic. So the Dutch government would say, we close down Schiphol Airport in Amsterdam. What would people do? They would go to Düsseldorf in Germany to fly from there, or even to Brussels to use this airport. So only when those three countries, for example, would work together, there would be a possibility to stop this outbreak. And of course, it's not only limited to the European Union countries. Perhaps you know that WHO, the World Health Organization, has a European chapter where over 50 countries are. And this is our, let's say, laboratory where we can work with.
Yeah, so it's deals more with health management, and outbreak management can be part of the study, to summarize it. To our audience, if you have questions, leave your questions in the comment section below and we will try to answer them as soon as possible, of course. What I've experienced a lot is questions about the curriculum of our program. Maybe Rok, as a teaching figure at European Public Health, maybe you would like to share?
Yeah, sure. Obviously, the questions about the curriculum are something that students face a lot. Why should I come here? What will I learn? What can I then take into my life to be successful out of this program? As we've heard before, public health is a multidisciplinary, interdisciplinary studies. So it's extremely broad. There's something for everyone.
Sorry to interrupt, but multidisciplinary and interdisciplinary means that it faces like many different topics, such as policy and law and all that kind of stuff. So for our audience who doesn't know the term, maybe just to elaborate, but please continue.
Yeah, it's a good one. It's good to explain these things. Sometimes I speak without thinking of this. So the way we approach it in the bachelor program, European Public Health, is that we look at two main things. The first one is, what are the main threats to health? So we have a module on tuberculosis, for instance. We deal with, in modules, we deal with stress as a public health risk. We deal with health issues that impact the mother and the child, and so on. So that's one way of approaching public health, right? Yeah. Through the prism or the perspective of the challenges that we have to face. But then the other one is through the perspective of the disciplines. So we can approach these different challenges by looking at them as health economists, or as epidemiologists, or as policymakers. So then in the bachelor we try to combine these two perspectives, these two approaches, so the comparative health approach and the European Union institutions integration approach, to create a professional that can really deal with all of the different perspectives and challenges in European public health.
Yeah. So also a question I get a lot, or maybe you've experienced as well, Professor Brand, is the question about trajectories, because for people it seems kind of vague. What are trajectories? What does it include?
Mm. Some of those issues that you have to deal with are cross-cutting. So it's not one issue, but it's something like critical thinking that you have to apply over longer time to different subjects. And it's kind of those basic skills that you need to be successful, regardless if you do now European public health or other things, because on the one hand you know your facts and figures, on the other hand you have to train your brain. And to train the brain is to have some good ideas about how can I analyze things. And there we put some subjects together in this, what we call trajectories, where it's cross-cutting and helps you to succeed.
Yeah, so basically it's a set of skills that are tested, so to say, in every module. Like they come throughout every module. We have something it's called epidemiology, statistics also as well. Something people are very afraid of, but totally manageable. So yeah, they come throughout every module and every courses. So maybe Sylvia also, would you like to?
So I would just give an example of what academic thinking is. So last month we did an assignment in groups about, we basically had to analyze the different opinions relating to brain cancer, so different stakeholders and which opinions they have and where do they rely on. So basically we got in groups, we wrote these 3 pages essay about all the different opinions, and everyone had their input, and basically that was an example of academic thinking. And then we have the statistics, which is you just learn throughout all your program, and then you try to apply it in the course you're taking. So for example, if you're learning about infectious diseases, you would just apply that knowledge and statistics into your subject, which I think it's great for your learning experience.
Yeah, what also varies to other universities is the problem-based learning system. Like our course is structured, you have a 6 weeks course, and then at the end of the course you have an exam, and then a 4 weeks course you have an exam, and then at the end of every semester you have a semester paper that you write, which is also a very valuable skill, I would say.
Maybe to point out, the semester paper is basically, for the students are watching, it's basically the university gives you the free to write about whatever topic you're interested on, of course related what you studied, but they give you the free to write in whatever you like and really to put your input into your work.
So for example, mental health.
Exactly. For example, if you're talking about mental health, you can just go in depth and try to research on mental health in prisoners, for example, and do a whole analysis comparing countries about that, everything according to your interest.
Or drug abuse.
Exactly.
Just among many topics. Then another question are teaching methods. So Rock, maybe your expertise is valuable here.
Right. So in Maastricht University, we mainly applied 3 different teaching methods. So the first one is what we heard about just now, is problem-based learning, so PBL. Then we have the traditional lectures that people are used to and I think know quite well. And then the last one would be workshops, right? So more practical aspects. I think it's important for us to explain what problem-based learning is, because I think this is really something that people don't encounter in high schools, they don't encounter in other universities.
Yeah.
So maybe Professor Brandt, you're quite experienced as an educator, obviously. How did PBL come to be such a central topic here at this university?
40 years ago, when Maastricht University started, the idea was, well, we want to do it a little bit different, not to have these lectures, 100 students, 200 students, because what you learn by this is limited. So the idea was, is there a system that makes it in a totally different way? And the Canadians developed problem-based learning. That, in a way, is that you have to solve a concrete and real problem. It's a small problem, but you're in a group, 10 people or less, where you sit together and discuss a case, and you have to find a solution. And there is some guidance for this. But in the beginning, of course, it sounds a little bit weird that as a first-year student you should solve the most important problems that the world has.
Yeah.
But it's possible because you already know a lot of things. And 10 years ago, before I came to Maastricht, I was head of an Institute of Health in Germany. And I have to say, I love to hire people from PBL background because they were really trained well. So as a freshman, when they joined the institute, I could give them a task, and they said, okay, in a week's time you will have an assessment of this. And they knew how to manage this. They knew how to lead a group, how to do a presentation, how to write up a summary, and to be very clear about their results. That you cannot expect from students that graduate at other universities. And this makes a difference on the job market too. So if you have a training in PBL, people know that you can solve concrete problems.
So it's really solution focused and based. And it's what I feel more like is a practical experience, a more hands-on experience.
To build on that, for me, the great thing about PBL is that in lectures, you basically learn the theory behind any topic, and then you go to your tutorials. So basically, it's the place where you apply the problem-based learning, and then you apply it. So basically, before in school, I was really frustrated all the time because I learned stuff, but I couldn't apply it anywhere, just retain it in my brain. But here in Maastricht University, you have the opportunity to apply it. For example, last week we had a tutorial about Ebola, and basically we had to define a strategy to combat the outbreak. So with all the group, we just went through the steps of how to deal with this outbreak, which is it's really practical and really useful at the end of the day.
Yeah.
I think it's important not to mix up problem-based learning and tutorials with seminars. I think seminars are something that people have experienced. Tutorials are much smaller groups, so it's a group between 8 to 12 people, and it's led by a tutor. But here the tutor is not in the role of a lecturer. A tutor here, as an educator, just strives to create an atmosphere where students discuss the issues that they have, the kind of learning goals they have to achieve, what do they already know, what is it that they still have to study up, and what tools will they need to solve the actual case that is in front of them.
Yeah.
So I think that's a major difference.
It's a more one-to-one relation with your professor, and the good thing is that in a lecture with 300 people, most of the people will not stand up and just ask a question because it's kind of hard. But in a tutorial, when you're just surrounded by your friends and your tutor, you're really free to ask any question and just make mistakes and make comments and improve your learning skills much more.
But compared to other studies, European public health is like in general like more of a small scale study program. Like the amount of people that apply for this study, like I think 120, like usually not more people apply for it, so that may.
But it's a good thing too, because then you really can focus on those, and you know your students, and the teachers have a totally different job. We are not here to give a lot of lectures. No, often lectures are given by people from outside that so that you can see how people are applying this. And we are more in constructing these cases, what's going on, and to mentor the students. And that's a different approach too, that, for example, I enjoy very much because having studied in Germany, I know how the different system can be. And here you really are engaged from the beginning to the end.
Yeah. So, welcome to any new viewers. This is today's European Public Health Facebook live session, so welcome to you. There's a question that just came in from Anna from Ireland. Why did you girls choose to study European Public Health?
So as Anna is questioning this question, for me, having the choosing studying public health was one of the best decisions I ever made, just because of the fact that in school I really enjoyed learning about biology, chemistry and mathematics, but then I saw that in my free time I really enjoyed learning about politics and ethics and philosophy. So I was really passionate about both fields, and not every program allows you to combine those disciplines, because a lot of people might argue they contradict each other, but public health gives you a chance to put it together, and you can make the most out of it if you find the good balance between both.
Yeah, well, after graduating, I struggled a lot with my many interests. Like I could go for law, I could go for like health sciences, like so many things that European public health includes. But then also, I thought that studying European public health would give me a more international perspective for my career. And also it allows you to go abroad not once but twice during your study. Once during your minor, like after studying 1.5 years of European public health, you can do your minor, you can do classes here at or like at other universities in the Netherlands. I think that's great. That's a great opportunity. I saw people go to Finland, to Malta, Australia. That was great. People told me like that was such an amazing experience, and now for the thesis, friends of mine are studying at the European Commission and writing a thesis there. So it's great. Yeah.
And listening to you both, it's interesting that you share this vision of a generalist. Yeah? You're not super specialized from the beginning. I want to be a microbiologist and there molecular biology. But you say I have a lot of different interests, and that is one of the key issues of public health, because health is made in all areas of policies. We even have this concept of health in all policies. So we need people like you who really are able to look into different areas too and are interested in this.
If I can build on that, when I was talking to my parents about, I want to study this degree, and they were like, are you sure about this? This sounds really specific. It's all about Europe and public health. And now I just argue all the time with them, because it's really narrow, because it's tackling public health, but in public health there's so many disciplines. You can, it's so broad. You can afterwards specialize whatever you like. So this is the greatest thing about this program and what I'm passionate.
So Professor Wan, how did you come to European public health?
Well, I got a grant from a region in Germany, because I wanted to go to in public health. North Rhine-Westphalia had 16 million people, 16 million patients. That was a nice idea. Now, but it was about, at that time, environment and health, that there was pollution and people were feeling ill, and we did not know exactly what were cause and effect. So I got interested in this, and then worked from the local level up to ministerial level. And then, for example, environment and health was not direct solved, but people said, okay, we know this now. And because, for example, North Rhine-Westphalia and the Netherlands share a common border, we had a lot of problems there. So the European dimension came up, and this was then more and more a driving factor. And here then the treaty of Maastricht was signed, where suddenly health was in. So someone had to take care about this. And so step by step we came up with concepts, how should we work together and how should this be. And now when you hear about the diesel scandal, it's an environment and health problem again. So suddenly you hear numbers of how many people die due to the ambient metals. So it's back again. So we now can rely on a European system. All the value limits were set up by the European Commission, where national member states don't have to reinvent the wheel. Look at Malta, 400,000 people living in Malta. They cannot do all the things again. And I think someone is going for the minor to Malta to the ministry there. And there, when the student will come back, he will say, okay, I was involved in adopting European regulations to the Maltese setting. And it's not seen as a burden, but as a relief.
Maybe also a nice addition then. Yeah. But Rock, you also have an interesting history of how you came to European public health.
My first career back in Slovenia was in medicine. So I graduated from high school. I didn't really know what to do. I was very interested in natural sciences, especially mathematics, physics, and so on. But then I decided that I don't really want to spend my life in a lab, so I decided for medicine. I finished my studies there, worked as a medical doctor, but I was still not satisfied because I wanted to be making more of an impact on my patients' lives, not just seeing them one by one and trying to help them, but really trying to make the world in which they live better, healthier for them, to really alleviate some of the frustrations they had with the health system. And then looking around for public health programs around Europe, I really happened upon Maastricht. I went to the open day here and I really felt that this is where I belong. So after finishing the master studies here, I liked it so much that I continued working here, and I want to really try to enable other students that come after me to have the same positive experience.
Great, sounds good. Well, we want to welcome all the new viewers who just tuned into this Facebook Live session of European Public Health. We will now discuss why Maastricht is a great European student city.
I'm in my first year in the bachelor program, so it's a really nice place to make friends. And one of my biggest concerns when I came here is, I'm gonna make friends. I'm gonna find a nice house. I'm gonna enjoy the university.
Yeah.
But all of these problems, when you're in the first day in university, they go away because just as we said, like the opportunity of having tutorials with a really reduced number of people allows you to make connections really easily with the people. And hey, let's hang out like after class. Everything is I see Maastricht University as a really nice community of people, which allows people to develop themselves and really have a really nice learning experiences. And to build on that, I really enjoy also how Maastricht University, on top of your program, allows you to learn other stuff outside of your own program. So for example, it offers lectures in Studium Generale to other topics that might be or might not be related to your topic, but really enhance your experience.
So, have you experienced something with associations or like the going out or like partying in this town? Maybe.
No, when my wife and I came over, we had a feeling like coming to Cambridge. Because it's a small town. People in Maastricht, please forgive me, 100,000 people. It's a little bit touristic because there are a lot of things to be seen. So you have a lot of international guests coming to this town. Everyone speaks English. Very
That's a really important point for international students.
Yes, and Maastricht, you can communicate in English, you can communicate in French, you can Dutch is very important, and they have a history of 200 years of Spanish here too. They have the Spanish gouvernement on the Friedhof. So it's very international, and you find your way around. And the hospitality is great, and for the teachers, it's sometimes you always have to behave well because you might meet your students in the evening in the streets. But you can't get lost, and you find your way around. And if something is, someone will help you. I think that's a very good start when you come to a foreign country. Yeah,
absolutely. Because it's not a huge city. It's much. You can find people. You find people here are much friendlier. You find that it's easier to make connections with other students. It's easier to kind of get around, get the logistics happening. So it's a very cozy city, and it's a very nice experience to study in.
And it's a suburb of Brussels.
Absolutely.
In 1 hour, you are in the center of European policy making, and for us, it's really important. Because, for example, in the placement of our students, a lot of students go to NGOs or the Commission itself or industry representatives, and later they work there. And Maastricht University has a campus there too, a small one that we can use for some events, and that is very helpful. And Maastricht is quite well connected. For example, last week it took me 2.5 hours to get to Paris by train. Unbelievable. So you are in a small city, but in the heart of Europe. And this is something that you don't do every day, but it shapes the spirit and how the students are. When I graduated, a trip by train to Greece, to Athens, took 2 days, and it was far away. If I listen to you, you go now by plane to a housewarming in Barcelona, and the real adventure is to go to China or India. But even there, European Public Health can help you, because we have one part, Global Health Europe, where we discuss how Europe should position itself to other countries. And I'm, for example, often in India, and India is now the pharmacy of the world, where we discuss with them, hey, how can we deal with antimicrobial resistance? Because you produce now the antibiotics that are sold here in Europe, and what kind of quality control measures we have. So having a placement in China, India, Australia, is not something exotic anymore, but I had to say I had to get used to it.
Going back to a little bit about living in Maastricht, for me, I come from a really big city, so just having the chance of studying in a small city where you can just take your bike and just meet your friends at any time in less than 5 minutes, it's great to really build on your friend group. And also we have the student association, we have the study associations, sport associations, which really make all your experience really easy. And as the professor said, we live in the center of Europe. Like even yesterday I was in Germany just for like a day.
Yeah, that's really nice. Yeah, it's really...
There's this saying, all students live in Belgium, study in the Netherlands, go shopping in Germany.
Yeah.
Absolutely.
Yeah. Okay, well, I mean, it's all nice and well studying European public health, but I mean, people often worry about what are career options. And like, Rock, maybe you know, like, is a EPH diploma acknowledged worldwide, or how good is it to get international perspectives?
I mean, Maastricht University is a very good university, and it's of course acknowledged all over the world, right? Maastricht University is a brand that is known everywhere. A lot of people are worried to study European public health as opposed to other public health programs that don't have the European in their name. But I would tell them that they shouldn't worry, really, right? Because the skills and the knowledge that you get here is broad enough to be applied in many different contexts. The European part in European public health does not limit you to Europe as a continent in terms of working. It just tells your employers that you have experience in working in multi-level governance settings. So that means in settings that don't really only have the national or the state level, but also a federal level, or also an international perspective in how to deal with public health. And this is why our graduates are very welcome in places like China, Australia, India, that also deal with these levels. How do I organize public health properly? What should be done on the local level? What should be done on a broader national or even international level? So with this kind of diploma, with this kind of knowledge set, you are very competitive internationally. Additionally, I think it's important to say that because public health is such a broad discipline, you can really find yourself in a job, so to speak, in a lot of different areas. From industry, working for pharmaceutical companies, through NGOs really representing patients and their rights, to working on a national ministerial level for the Minister of Health, for instance, internationally for WHO, the European Commission, and so on. There's really a lot of options and a lot of need for graduates of European public health.
So I would say that your master program, like the governance and leadership and public health, that prepared you very well for the labor market? Yeah,
exactly. So building upon the bachelor program, the master's is somewhat different because it doesn't focus only on comparing health and this multi-level governance aspects, but it really focuses on assessing health really in detail, really well. Then it focuses on identifying what the useful solutions are for the health problems that we identify. And then lastly, how to really implement these solutions. And this is something that's needed today. Everybody has an idea. Everybody thinks they know what has to be done. But the key challenges really are in implementing these solutions. How do I know that this idea will work in this context? And this is, I think, what really helped me in my master's.
Okay, so
Perhaps just multi-level governance, what is this?
Yes. So it's it's difficult to define, but I think in very broad terms, multi-level governance just means that there's several levels, so several stages that make decisions about how things should be done. So your municipality does some of the decision making, but also does the state, and so does the federal or national level.
Okay, so there's a question from our audience, from Mary. Did students have any issues finding housing close to the FHML buildings?
I can answer that question if you like.
Yeah, sure.
So most of the students in our faculty, so FHML is not really in the city center, so it's a little bit far away, but there's a train that goes directly from the center. Or buses, or people just ride the bike, 6 minutes, you are there. And most of the people live around the FHML faculty or around the center. And the best way, in my opinion, to find housing, first of all, is not leave it for the last minute. So if you're planning to go into Maastricht, start looking now, because it's not the easiest thing to find housing in Maastricht. So just start looking now, find your place, find a nice place close to the city center, close to FHML, whatever you like. And I would recommend look at the Facebook pages that Maastricht offers for housing for students, or Maastricht Housing, a web page offered by the same university, which are really great, and they can offer really nice houses.
Okay, so for those of you who are tuning in just now, we want to welcome you to our Facebook Live session about European public health. We have, if you have any questions, leave them down in the comments below, and we will try to answer them as soon as possible. Okay, Angela. After getting your bachelor in EPH, will you continue with the same master program at Maastricht University? Well, I guess as I'm very close to graduating, I'm definitely keen on doing my master program here, because I really like the master programs, and I've grown very attached to the university as well. So I don't know, maybe if a very exotic or international thing comes up, I might, but currently I'm also interested in the master that Rock just did. But I don't know, Sylvia?
I'm in the first year, so master is a little bit far away still. It's 2 years, but I'm definitely interested in studying in Maastricht University, just because I'm familiar with the program. I'm familiar how it works and the professors and the system. But obviously, also nice always to go abroad, discover new programs. I think the master is really a nice chance to really define what you like. And if Maastricht University offers that, go for it. If other places, go for it. I think it's really tailored to your individual level.
But I think it's also what the university promotes is to do international experiences as well.
What really attracted me to pursuing a master's at this university was, well, several things. But the main thing was really that it's a one-year master. You can really tailor it to what you're interested in. So the master program gives you the tools, but you have to bring the interest. And lastly, it's this international English perspective, right? So I had schoolmates from more than 10 countries, I think, around, not only around Europe, but around the world. And the entire master really was done in English. So it was very easy for us to follow, get along. So I really, at first I was a bit worried, I don't speak Dutch, how will I manage? But because of the city and because of how the university works, I really got along easily.
I think you touch on a really nice point about nationalities. So in my first year of the bachelor program, we have over 17 nationalities, and people coming from China, a lot of people coming from America, people from England, Spain, Australia.
Finland,
so it's a really international perspective, and it's really important because you really see different perspectives. So that is one of the key aspects why I choose Maastricht University, and one of the reasons I might choose Maastricht University to take my master.
And you're then the ambassador of your own country.
Exactly. Everyone brings a little bit of their own country, and this international atmosphere, it's the best learning environment in the 21st century.
So Hannah is asking, do you guys as students have already an idea what you will do after you graduated EPH regarding your career? Okay, so after my master's, I'm keen on working in health promotion, for sure. Currently, my topic of interest is like work-related stress and like a healthy work environments. I'm attracted to that a lot, so currently I'm gravitating to it, but maybe in 2 years I'm like, let's do mental health, let's do diet. So yeah, it varies.
Yeah, perhaps I can report a little bit about the 10 years experience that we have with the BPH, because for 7 years now people are graduating, and the first good message is after 6 to 8 months everyone has a job if they want or not. And this or not is important because there is always this network. When the first ones have their job, they inform them, hey, there's a second job now on offer. Are you interested to be part of it? And where do they go? Around a third work for NGOs, non-governmental organizations. Often these are groups that are formed from civil society, so citizens who want to see more action, for example, on children's health or environment and health, or it's more disease-specific, cardiovascular disease, lung diseases, or so. All those groups that try to put this into at the center of them. Then you have some people who work for consultancies. Consultancies are companies that provide advice for decision makers. Often you hear the name lobbyist. That often has not a good connotation, but consultancies help a lot to structure processes, and there it's a good job opportunity for 1 or 2 years to have the first experiences in this field. Then we see that another third goes to regional governments or regional institutions, so not on the national level but on the regional level, especially here near to the borders, because around I think 30% of the population live in a border setting, and when you have a European border, then certain things are possible that are possible not in other areas. For example, you can seek healthcare. So the students, the graduates are really sought after for this kind of institute. And it's really from local, regional, national government, about sickness funds to all those other areas. And this is one of the good messages. You don't have to worry about job opportunities.
Abigail is asking, what is the ratio between male to female?
So in the first years, so basically, I would say that there's more females than males in the program. That's a fact. In a lot of health sciences, we see this ratio. We like to see more males in the program, I think, maybe.
Male dominance.
But to build on that, I don't think it's an obstacle because everyone has their own opinions, but there is more females in the program than males.
Yeah, currently at least.
Yeah, the same goes for the master program.
Yeah. All right, Angela is asking, how many people attend each year the master in EPH?
So the master program is also quite small, and we like to keep it that way. So on an annual basis, we get between 30 and 40 students. And it's really a great experience because that means for a year you know all of your colleagues, you get really individual attention from your students, not from your students, sorry, from your teachers, from the staff. And you can really develop yourself as a person through mentoring sessions and through really individualized learning here.
But afterwards, if you're such a small group, do you also tutorials? Or you just like tutorials are with the same master program? Or
no. We still do tutorials because tutorials, then we can do tutorials in groups of 8 to 10. So usually we have 3 to 4 tutorial groups in that setting.
Nice to know.
But not all students, let's say, come from the bachelor directly to the master.
No, absolutely not.
And that is good because we want to see not the old faces, but it's a
Exactly.
mixture. Yeah, because for you, when you are, then we are 30 and we know each other. No, a third of them come from the bachelor, and the others come from other bachelors, not only from Maastricht, but very much from Europe. So you have a new bunch of people, and that's good for
New
those who
ideas.
really from the bachelor go there. So, and on the other hand, it shows that with the bachelor here, when you apply for other masters abroad, you have a good reputation.
Yep.
For example,
Good
when
to
I
know.
speak to those people who go to Karolinska Institute in Sweden or Land School of Hygiene and Tropical Medicine or Land School of Economics, they say, well, we don't have a problem to follow this, even if it's a different setting, because we heard it all already. And then in the master they have, let's say, 2 cycles more where they can deal. But the feedback what we get is that with a bachelor from EPH, you can start any master abroad without getting into trouble.
Yeah. Another question Angela asked, Rock, is maybe for you. She asked, like during the 1-year master, like she worries about many exams.
Right.
Would you?
I think it's very much feasible. I think it's very much doable with the exams and the tasks that you have to accomplish. And I think this is also because of the way the study programs are structured here. I don't know if the viewers tuned in at the beginning, but we discussed this a little bit, that we follow a block system here, so that you have classes for 4 weeks, 6 weeks, or 8 weeks, and then you finish this class, you finish this module with an exam, and then you move on to something else. And this then really allows you to focus all of your attention on studying a particular subject, a particular topic, finish the exam, finish the papers about this topic, and then move on to something else. So it's very efficient, and it allows you to be extremely productive, maybe more productive than in other settings.
Yeah.
Yeah.
It also really allows you to, for example, the first module is on tuberculosis, and basically you just focus on that, on infectious diseases, tuberculosis, but also you have the chance, as I don't know if we really mentioned, but there's really a little contact hours with university, so you have a lot of freedom to really go into the research and go deeper into this topic, like really focus on what you're interested in that module. So I think it's really one of the great things we can touch on.
Another question is if the EPH diploma is acknowledged worldwide, but
I think it absolutely is. Maastricht University has a great reputation around the world. It is well known around the world for its work and also for the success of our graduates. And an EPH diploma gives you a lot of skills in applying public health in very interesting multi-level governance settings that we discussed before. So, and you can find these settings all around the globe, from the United States of America to Australia.
And we are reassessed every several years for our accreditation. And by this there's an external quality control, and you can be sure that it's for high standard. And in the internal rating of the Netherlands, Maastricht University always has a good ranking, thanks to the verdict of the students.
Yeah, exactly.
if you have any burning questions left, make sure to ask them while we're still live. Yeah, another thing that might be interesting is a piece of advice for new students. General.
So last year I was in the same situation as maybe other people behind the screen, but I would really appreciate some piece of advice. So first of all, use all your contacts, like the friend of a friend of a friend who studies in Maastricht University. Contact them, ask them about the Maastricht University, the program, if they know it. Also, you can also contact the university by the emails that they will be below, I think, and get as much information as you can. Also, find housing, I emphasize that again, and really read about public health before taking a decision. Get books, inform yourself, read the news, and try to understand what public health is about, because then when you come into the bachelor, you will say like, oh, I understand this a little bit more.
Yeah. But also, because we all moved to the Netherlands, luckily it's not necessarily required to talk Dutch. So maybe for students that are international or that are coming from abroad, do not have to worry to learn Dutch, because the city is, as we mentioned earlier, quite international. And to come back to the earlier question, in some cases with the worldwide acknowledged diploma, you have to do in international countries, like outside of the EU, maybe some additional assessments to like verify your diploma, I would say, or like maybe
perhaps if you're trying to enter postgraduate studies such as other master studies or a PhD program, for instance, because within the European Union we can of course acknowledge each other's diplomas and certificates directly, but outside the European Union we don't have control over them. So certain very competitive programs might require you to do some extra courses.
Yeah. Do we have other piece of advice for students?
There was one question regarding switching between EPH and medicine. That comes often too, because some people and there the track for medicine is separate. So this is you cannot change from one to the other. You really have to apply then again new for the medicine track, because here problem-based medicine is taken for medicine too. So it's a separate track. And what is interesting is that next to EPH there is a health science a bachelor in Dutch. So there is a coexistence between some training that is in Dutch and the international community. And that makes it very interesting too, so that there you can see that the Netherlands are quite an international place to be.
Are there any remaining tips or pieces of advice?
I would just say take the leap and really join Maastricht University. I never regretted it, not even a little bit.
Me neither. Abigail is also asking, what time do classes usually start?
The good thing about Maastricht University is that you don't have a fixed schedule, so every day might look different, more or less, at least in the bachelor. So there's one, as we said, like we work on modules. There's one module, for example, that you will have 3 lectures a week, and 2 of them would start at 8:30 sometimes, but sometimes it's at 11, which is sometimes great. But your schedule is really, it moves all the time, which is really great and makes a routine different, which I really enjoy.
But that's like also a side note, you are not able to make your own schedule, like it's fixed. Because that varies also from country to country. In some countries they can like, okay, like I make sure like I have 3 full days and then I have 2 weeks off, but that's not the case because the university just fixes your schedule.
And then to build on that, lectures are not mandatory, but you should attend.
Not always mandatory. Or like, no, sometimes mandatory.
And then tutorials are mandatory, so you have to be there, and attendance is extremely required.
Because also like kind of exam preparation, tutorials.
Yeah, absolutely. I mean, for the first time in my life, I really wanted to attend every single lecture, every single tutorial, and every single workshop, because they really try to optimize the contact time here. Right? So as opposed to my previous experiences where I had almost 8 hours of educational activities every day, here they really try to give you enough freedom and enough space. Focus lectures really into 2-hour blocks so that you get the most out of it. Have these PBL sessions that are also usually 2 hours in length, really focused activity, and then usually you would have a lot of free time to do your own reading, your own studying, and also enjoy life as a student here.
Yeah, but I would also say like it teaches you time management.
Absolutely.
So, all right.
And you cannot get lost, on the other hand. Even if you have this freedom, when you don't show up at the tutorials, your colleagues will ask you, wait, what's with this person?
So what's happening?
So that's important. In other countries, no one takes care about you if you're in the lecture
that's
or
true.
not. So this is something where you can be sure that if you're sick at home, someone will ring.
Someone will notice, All right. Thank you very much for this Facebook Live session. We have come to the end of this session. For everyone that has watched the full 50 minutes, thank you for watching, or anyone, thank you for watching, even if you just tune in for 30 minutes. We wish you the best of luck choosing a study program, if it's at or European Public Health, it doesn't matter. We just hope this session was very informative for you about European Public Health.